Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Sharafsaleh, providing you with information on aging-related topics. Learn more at geriacademy.com and follow me on social media.
Hello, friends. Welcome to episode 5 of the Geri Academy podcast. I'm your host, geriatrician Dr. Sharafsaleh. Today, I wanted to talk to you about osteoporosis, the other deadly killer. So osteoporosis pretty much means weak bones. My guests are Dr. Shushan Wang, a geriatric fellow, and Dr. Chris Rice, a rheumatology fellow. Did you know that 300,000 people are hospitalized every year for a hip fracture? That 95% of those hip fractures are due to falling? And did you know that untreated osteoporosis can lead to premature death? So let's learn more, prevent fractures, and get stronger. Hello, guys.
Hi.
Hello.
Thanks for coming on the show.
You're very welcome. I'm glad to be on the show.
So, Dr. Wang, you just wrote a blog. We called it Don't Give Me a Break, Osteoporosis and You, on the Geri Academy blog site. And it was a great read. It's quick and it's, I think, informative. But just tell us a little bit about yourself before we start talking about osteoporosis.
Okay, well, I am a geriatric fellow with Blue Ridge in Morganton, North Carolina. This is my first year and only year into it. I've been greatly enjoying myself. Before that, I was working as a hospitalist at the same facility. I've seen a lot of elderly patients coming in and out, which, actually kind of inspired me to taking care of older patient as more of a specialty, or it's my passion to take care of older patients as much as I could.
It's kind of interesting that you guys are actually married and one of you is going to be working as a geriatrician and the other one as a rheumatologist. I think the two specialties really blend well together. So Dr. Rice, tell me a little bit more about you.
So I'm currently in my second year of a rheumatology fellowship, which is a 2-year program down in Augusta, Georgia. So I see patients at the Augusta University Medical Center and also at the Charlie Norwood VA Medical Center there. And it's a very interesting specialty to me, and I was very excited to hear the opportunity to talk about osteoporosis, since this topic is very relevant, that we see it in both those patient populations I work with.
Yep. Our hospital system, it's interesting. We started a fall clinic, and our last podcast, we were talking about falls, but one of the issues that we have is so many people fall and break a hip and they have osteoporosis, and it's never detected until they have that tragic event. And so I'm hoping with this podcast, we'll be able to inform our listeners so that we can maybe even prevent some of those fractures that, are an outcome, a result of untreated osteoporosis. So, can you tell me a little bit about the incidence or how common osteoporosis is, Dr. Wang?
Yes, for sure. So it's a very common, actually, disease that is silent until it leads to something serious. Approximately 10 million Americans suffer from osteoporosis, and additional 44 million are at risk for developing it. And women are more prone to it when they're reaching their menopause, and about half of all women in their lifetime will break a bone due to osteoporosis, and they're actually twice more likely than men to develop osteoporosis.
It's really interesting. So, Dr. Rice, with you being in rheumatology, how often are you seeing men who have osteoporosis? Because I think we are, we don't think of men as being at risk, but the literature, the data shows us that there are some men that are at risk.
Yeah, absolutely. And so I'd say that in my mind, I tend to think of two groups of men who are at much greater risk for osteoporosis compared to the general population. And one is, I don't see them, but men who've had any kind of hormone deprivation therapy, usually associated with things like prostate cancer or other things during their lifetime that can uh, really negatively affect their bone density, from that point out. But then in rheumatology, the inflammatory diseases that we see patients on, and also some of the medical treatments they receive, especially steroid treatments, which are very common in rheumatology, puts those men at much increased risk for osteoporosis, even though you typically think of men as being at an overall relatively lower risk. That is a very common thing in my field. So I do see a lot of men who are at greater than the average risk.
Dr. Wang, can you elaborate a little bit on how women tend to lose bone as they get older?
Okay, so both men and women build the bone about same rate and have the most robust bones in their mid-20s, after which the rate in both start to lose. In women from their mid-30s and 40s, their bones are generally stable, and there's very slow bone loss. Around mid 40s and 50s, women start to experience more rapid bone loss, especially during menopause. They can lose about 7% per year. By mid 50s to late life, women will continue to lose bone at a rate of 1 to 2% per year. For men, after age 30, there's a more steady stream of losing. There's about 1% of bone loss per year, but they can lose up to 6% bone yearly, depending on what risk factors they are.
Okay. And so can you talk about some of these risk factors? I know there's some that,
Sure.
are modifiable, like we can make some behavioral changes and really reduce our risk of having osteoporosis. And there are some risk factors that we just can't do much about.
Right, for sure. That's a great point. So, people are at different risk factors. Different depends on your genetics and what you do. There are risk factors that can be changed. There are risk factors that cannot be changed. Things like older age, location, ethnic background, previous fracture, family history of osteoporosis. These are the things we can't change, right? But the risk factors that can be changed are something we could work on, including, sedentary lifestyle where you do little or no physical activities, or cigarette smoking, excessive use of alcohol, and poor nutrition or rapid unintentional weight loss, or their base body weight less than 127 pounds, they're at higher risk. There are other chronic or acute diseases the person is living with, things like thyroid diseases, liver diseases, chronic steroid use, like Dr. Rice mentioned, vitamin D deficiency, chronic kidney disease, or hypogonadism, which is a condition where the body doesn't produce hormones like testosterone as efficiently, or other things like rheumatoid arthritis or other inflammatory diseases.
Okay. And how, I know that chronic kidney disease and diabetes and some of the other like thyroid disease, how would you say, Dr. Rice, these disease processes are like leading to osteoporosis? Why do those increase our risk factors?
Yeah, so it's the exact mechanism by disease is a little bit complicated to go into in some of those cases, but as a general part, seeing what that is, the minerals in your bone which give them strength, namely calcium, is carefully regulated in your body by hormones. And so particularly with things like kidney disease, and also to some extent with then, thyroid disease or chronic inflammatory diseases, these hormonal control of that bone strength gets altered. And so a lot of times that can cause you to lose your calcium from the bones, which takes away their hardness, at a much accelerated rate. And in rare circumstances can actually cause there to be too much calcium deposited into the bone, which can actually make them too brittle if the hormones are too far in the other direction.
Okay. And Dr. Wang, so who should get tested for osteoporosis?
So right now, the recommendation is that every woman over the age of 65 should be tested. And additionally, any older adult with a risk factor that we just mentioned or loss of height by more than 1.5 inches should be tested regardless of gender. For men, there's no routine testing recommendation just yet.
Okay. And so what is the best way to get tested for osteoporosis, Dr. Rice?
Yeah, that's a great question. Thanks. So we actually have a very good test for osteoporosis. It used to be we didn't know you had it until it caused you harm, which is problematic because most of our treatments are good at reducing your risk, not for, fixing problems immediately once they've happened. So the best test we have is called a bone densitometry X-ray scanner. We'll refer to it as a DEXA. This is basically a very simple, fast X-ray that just looks at how dense your bones are. And this, we've actually had this test now. I think it's started in the late 1980s and became more widely accessible in the 1990s as a very effective screening test. And this has actually led to we have a really, really large amount of data why we know this test is good. Some of it comes from the Women's Health Initiative and, other large studies in the United States and abroad that this DEXA scan is very good for detecting osteoporosis long before it's caused any damage.
And what are some of the common sites that are X-rayed?
Yeah, so most often we'll look at the density of bone in the low back, the bones of the spine, and then also looking at the bones of the hip. And we look at these areas, one, because they're pretty consistent, and also because these are areas where people very often have the fractures from their low bone density. So looking at the bone density there really does help, give us useful information.
Okay. And how often should an individual get tested?
Yeah. So that can depend a little bit on what the findings are. Definitely, it's recommended for all women after menopause to undergo screening, usually by age 65 or sometimes earlier if there's any other risk factors, concerns, even potentially a very strong history. For men, it's a little bit less clear if there needs to be a routine screening of all men versus men who have some type of risk factor in their history, like the ones we talked about before.
Okay.
And then the follow-up testing, bones don't change too quickly over time. So in some cases, if someone has a bone density that we're needing to take some kind of action or treating for, sometimes repeating after about 2 years is enough time for us to really see a change in the bone. But sometimes we may not have to check so often for people who look like they have stable or healthy bones.
Okay. And what if the DEXA scan says osteopenia, not osteoporosis? What does that mean?
Yeah, so osteopenia is essentially a number where your bone density is low when compared to average bone densities, but it's not so low that you're felt to be at as substantially great risk of a fracture or as you would be with osteoporosis. So essentially it's a low bone density, but not as low as osteoporosis. It's a distinction we tend to make because when the risk is not as great, it's more likely that things such as behavioral changes or dietary supplementation can help prevent the further bone loss from getting you into osteoporosis.
Okay. And then, Dr. Wang, how about preventing osteoporosis? Now, we've done this bone density. Let's say you are at risk for having osteoporosis, but you don't have osteoporosis, or you're younger and you want to try to prevent getting osteoporosis in the future, what can you do to prevent osteoporosis?
Very good question. So, when when you find out you have osteopenia or lower bone density, you always want to figure out, if there's any other thing that's causing it, like other underlying diseases, thyroid disease or kidney disease, and try to modify risk factor by treating it appropriately first. The second thing is that you could modify lifestyle or habits where you participate in more weight-bearing exercises, or trying to quit smoking, decrease alcohol alcohol consumption, so that you would get your body stronger to build up the bones. And the third thing you could do is to actually replace some of the essential vitamins and calcium, trying to actively build your bones. The two things that we want to talk about, one is vitamin D and the other one is calcium. The FDA recommends that older adults take 800 units of vitamin D3 daily. So vitamin D has been shown to maintain bone health and actually linked to preventing falls in older adults. When it's combined with calcium, it has been shown to reduce the risk of fat fractures. So a daily vitamin D supplement at the recommended dose is safe to take. And but don't forget all the diet source, right? There's a lot of diet out there that's rich in vitamin D, including milk, yogurt, some fish like sardines, tuna, and leafy greens or beans. Actually, some animal livers will also be rich in vitamin D. Eggs and certain mushrooms, they're all rich in vitamin D. Now, for calcium, it's a little tricky. The daily recommended dose of calcium is about 1,200 milligram. It's about a little bit over 1 gram a day. But don't forget, this includes the calcium you eat in your diet. So don't forget, if you're eating enough calcium-rich food, you don't need to take additional supplement. Too much calcium actually would cause some trouble. So if you want more information, you could go to Jerry Academy blog on vitamins and herbs and discuss in details about vitamin D and calcium supplement.
Yeah, and on your blog, you have an excellent chart on what items contain how much calcium, and you even had an example. So like if someone has a cup of yogurt a day, that cup of yogurt is maybe about 250 milligrams of calcium, right? And then a glass of milk might be about 150. An ounce of cheese is like 150 to 200 milligrams. And so if you eat that every day, that's going to be a lot of calcium, and you may only need 500 to 600 more milligrams a day, not actually taking a full 1,200 milligram tablet of calcium, which can cause kidney issues, constipation,
Correct.
And it's right, not pleasant to have calcium side effects.
And one small things for good for people to know, that if you want to take calcium, take it in small portion. That's actually help your body to absorb it. If you take it in a large portion, large pill, that's actually harder for your body to absorb.
Yeah.
So small, frequent.
I think that's like great advice. Yeah, I what I've noticed usually when I see patients in the office, they're like, oh, I take these 2 pills. This is my calcium per day. And then you ask about their diet and you're like, oh, no, wait, you're taking way too much calcium. And then I think once we fix that, we're like, okay, now this is a combination of your diet, and then maybe just take this one pill, then they don't have some of those side effects. And again, the big one that I see in our practice is constipation, I would have to say.
For sure.
Now, yeah. So Dr. Rice, we've talked a lot about being active, preventing osteoporosis, the types of nutrition that we may need to consider, and nutrients to prevent osteoporosis. But if someone has osteoporosis, can you talk to us a little bit about some treatments that are available?
Yeah. So we actually have a couple different types of treatments now. I think that talk about the vitamins and nutrition is super important. But it is true that in general, the diet supplement activity alone is not going to bring the bone density up especially in elderly individuals. But it is more likely to help prevent further loss. Fortunately, we have several different types of medicines now. There's actually oral medications that can be taken on a weekly basis. There's some injectable medicines that can be used at home, which are under the skin shots. And then less frequently dosed every 6 or even 12 months, there are some medications that can be given in an infusion center. Some of these work by really stopping more bone from being broken down, and some of these can actually accelerate the building up of new bone. So usually the selection of a particular medicine is something that you'd have to discuss with the physician, because they'll need to look at, any other medical issues and medicines you're on. And also, how severe is the osteoporosis that they're looking at? Are you someone who's had recent fractures versus are you just now being picked up by a screening test and might not need as aggressive medical therapy alongside doing some of those lifestyle changes?
So Dr. Rice, one of the things that I see in the hospital setting is oftentimes we have an older adult who breaks a hip because of a fall. Now, we know that that person now has the diagnosis of osteoporosis, even though they have not had a bone density. Just having that fracture gives them that diagnosis. Now, is this a person that needs to start treatment for osteoporosis?
Yes, absolutely. And I think this is currently a big area we can improve on, both from the patient understanding and for the physicians. The fact of having that major fracture of an important bone, like in the spine or in the hip, by itself shows that there's weakness of that bone that would benefit from being treated. And so there are a variety of medications like we were talking about, and it's really important that people who've had a fracture like that do get on treatment, since they have a significant risk of another fracture in the future due to the frailty or relative weakness of the bone. So far, when this has been looked at, it's a lot of people who are appropriate and would benefit from this kind of medication therapy for osteoporosis are actually not getting it due to it not being thought about as much, or treatment started as aggressively as it could, even without any specific kind of DEXA test or other, evaluation with the osteoporosis.
Yeah, and it's just interesting because, when I was in medical school, there really wasn't that much, in terms of options for treatment. And all of a sudden, over the last like 10 years, there's so much more option for treatment. And so if a patient doesn't tolerate one type of treatment, there's always another option. And if one treatment doesn't seem to be working, then there's always another option, So I think being able to address this disease process right now is so much better than the way we've been able to do it in the past. And I also think we've kind of ignored this disease for so long, but because the country is aging, right? The world is aging, and we're going to have so many baby boomers by 2029 reaching 65 and older. We have to protect them. We have to prevent them from falling. We have to prevent fractures just to preserve quality of life, right?
Absolutely.
Yes, definitely.
Yeah.
I think it's an area, there's been a tremendous improvement in our science, that we have more treatments now for osteoporosis than ever before, but we really haven't seen a much of improvement in our screening and identifying it and starting those treatments any more than we already had been seeing since the 1990s.
Yeah. So, you guys, thank you so much for talking about this topic. It is near and dear to my heart, just because we treat so many patients with hip fractures because of untreated osteoporosis. What is one takeaway that you really think our listeners need to know?
So one of the takeaway is that don't wait till you have had a fracture, injury, a serious effect from osteoporosis. Just because it's usually asymptomatic, it usually doesn't have any symptom before you pay enough attention to it. About 1/4 American age 50 and older who have a hip fracture will die within a year of the injury, and half of all hip fracture old elderly patient never regain full function on the affected joint. So this is a very serious illness, and it's definitely treatable or amenable if you pay enough attention early enough.
Dr. Rice?
Yeah, I definitely think being very aware of this and the fact that there is screening out there and that early treatment is much better than waiting until there's been a lot of harm later in life. So, I think trying to be healthy and getting an adequate calcium and vitamin D and some physical activity early in life really does pay dividends in this. And then talking to your doctor, especially for women who are, progressing through menopause and may have other risk factors as well, or anyone who's getting into age 65 or older, bringing it up on whether you'd be appropriate for screening, and then based on the findings whether a treatment could help really limit your risk over the next 10 or 20 years of having such a major event.
Yeah. Thank you both so much. And Dr. Wang, I just have to tell you that you had excellent references and up-to-date information on your blog. And so I think that our listeners would really benefit if they checked out the blog. And, it is organized well. And so thank you for that. And thank you guys for doing this podcast with me. And I'm hoping we have a great deal of listeners who learn something new, and hopefully it benefits them or a loved one.
For sure.
Thank you.
Thank you, guys.
You.
Yep. Thanks. Bye.
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 Thank you for listening to this episode of the Jerry Academy podcast. Learn more at jerryacademy.com or follow me on social media for information on future episodes.